Thank you for joining us for today's webinar, State Health Insurance Program, or SHIP, Partners and Services Managers, presented by Kathy Madden, SHIP and SMP Partners, Services and Training Manager. That's a lot of words for the Colorado Department of Regulatory Agencies, or DORA. So a lot of us might just say from DORA. My name is Christy Moran, and my pronouns are she and Aya. I am the Adult Library Services Senior Consultant at the Colorado State Library, which I just like to say that means that I am a librarian for folks who work in libraries, librarians, library professionals throughout the state of Colorado. Kathy has a robust presentation for us today, and we will share the slides as well as any resources shared during the presentation, as well as the web recording link to all the registrants, whether you're able to stay the entire whole hour or you're not able to show up at all. If you have any questions, please put them in the chat. When Kathy either will take them as she goes if it's relevant and she can do it, or we'll take them at the end. I'll make sure to read them aloud so that the entire question is caught on recording for those folks who will view later. I am going to turn it over to Kathy now. But before I do that, I'm going to grab that presentation because I will be sharing the slides. Kathy, let me know when you would like me to advance the slides as we go.
I will. So I just wanted to say hello to everybody and let you see my face real quick. Started, can I just give you guys a big thank you for what you do? I was telling Christy, I am a huge library proponent. Like, honestly, as a kid, the library saved my life. I was always one of those kids that was reading constantly, and we lived in Minot, North Dakota, which is a little place on an Air Force base that maybe had 20, 40 families, and the only time I was able to get to a library was the bookmobile. I would sit on the patio and wait on the bookmobile to come around like an ice cream truck. I was so thrilled to get on that bookmobile and be able to pick out books for myself. Like, I think about it now as a kid, and I almost want to cry. It did save my life. I love going to the libraries. I'm still in there at least once a week because there's so much stuff you can get and do and learn and everything. So I just wanted to say that before I get started. Thank you for what you all do. I mean, I just think the library is such a huge part of our civilization and our growth and all of that. So I just wanted to get that in there. So having said all that, let's just get started with the presentation. I am from Colorado SHIP, and the SHIP program is, you'll hear it a lot of different names around the country. We are nationwide, and we are called the State Health Insurance Program here, SHIP, but you'll hear it called Senior Health Insurance Program other places. Other cities or states have different names like SHINE and other programs. But what we do basically, go ahead, you can advance the slide. So our mission here at SHIP is to empower, educate, and assist Medicare-eligible individuals through objective outreach and counseling. So our vision is to be locally known and trusted as a resource for Medicare information to beneficiaries. Go ahead. So what is SHIP and how do we help Medicare beneficiaries? So the Senior Health Insurance Program is a national program that helps Medicare beneficiaries, their families, and caregivers make informed decisions about their health care and benefits. So we offer counseling, education, one-on-one assistance to help people understand their health coverage, to make informed decisions, and to make the best choice for their needs. We are free and unbiased, right? So we don't steer anybody into plans. We have no impetus to steer anybody into anything because we are free and unbiased, unlike brokers who actually are there to sell health insurance, and they usually are affiliated with the plan, right? Aetna or Kaiser or United Health, whoever, and they are really trying to steer customers into those plans because, of course, they make commission. With SHIP, we are free, unbiased. Whatever is the best plan for you is what we're going to talk to you about. SHIP services are available to Medicare beneficiaries under 65 with disabilities, people who are dually eligible for Medicare and Medicaid, and people with limited incomes. Okay? So this slide just gives you some just numbers. I'm a number fanatic. I like to see this kind of thing. But just to give you an idea of how many Medicare beneficiaries are in the U.S., and as you can see, there are so many Medicare beneficiaries, which is why you hear about Medicare in the news all the time, right? It's a huge, huge part of our federal budget. That number includes people that aged into Medicare at 65 and disabled individuals who get Medicare under 65. And it also includes baby boomers who are aging into the Medicare system at the rate of 8,000 people a day. And when I see that figure, it really does blow my mind, because it's kind of amazing to me that many people, 8,000 people a day, are aging into Medicare, which is, and I got to tell you, probably 7,999 of those people don't have a clue about Medicare, which is why we're here at SHIP, right? We get a lot of new to Medicare people where we sort of explain the process and all of their options and all of that. In Colorado, there's about 1 million residents, 17%, and our dual eligible population is quite large. We have about 90,000 of those, and again, those are people who get Medicare and Medicaid. And if you're dual eligible, meaning you get Medicare and Medicaid, it's really some of the best insurance you can have, because if one doesn't pay, the other one will. So we'll talk about that later. It's approximately 8% of Colorado Medicare beneficiaries who are dual eligible. Okay. So where are we located? So we have 54 SHIP grantees, one in every state, plus Puerto Rico, Guam, D.C., and the Virgin Islands. There's approximately 2,200 local programs and about 12,600 counselors. Now, these folks are mostly volunteers. There are paid staff, but most of those counselors are volunteers, and they conduct over 2.5 million counseling sessions per year. So that's quite a few counseling sessions. Most of those take place during open enrollment, which is October 15th through December 7th of every year. That's when we do most of our work. Probably 40% of our people that we contact us happen during that time period. Local SHIPs do extensive outreach to their communities, right? They educate people on Medicare and Medicaid related issues. They have fairs, they have festivals, they set out booths for information. All of those kinds of things happen at the local level. In Colorado, there are about 16 SHIP affiliates, over 220 counselors ready to help in the following counties. Go ahead. I'm not going to read all those to you, but you can probably see your county represented here. If not, then we would love to maybe talk about having someone become a SHIP service area. But we're pretty saturated. It's been a few years since we actually added an office. I think we added one down toward Greeley, and they help with open enrollment. For the most part, these are pretty stable counties, pretty stable offices. They're usually attached to the area agency on aging affiliates, and they get funding through the state office to carry out SHIP duties. Okay. This is just a map showing you sort of where we are in the state. So what does SHIP offer? So we offer free and unbiased health counseling. So what we do is we help people compare plans, right? Compare Medicare Advantage plans or compare Medigap policies, or we help them compare what their existing coverage is through work if they're thinking about retiring and they don't know, should I hang on to or let's say they're still working and they're aging into Medicare and they think, should I stay on my existing work health insurance or should I go on Medicare? We help them sort of look at what would be better for them, right? What offers more, what would be cheaper overall for their services. We review existing coverage. We explain how Medicare works with Medigap policies, Medicaid, retiree coverage, and other insurance like para. We help them make informed Medicare decisions, right? We don't steer them into anything, right? That's not what we do. We're not trying to steer them in any direction. However, if a beneficiary is coming and they want to join a plan that I know is not good for them because all their drugs aren't covered, or they don't want to get referrals to go out of network, but you have to always get referrals. Those kind of things, we'll talk to them and say, well, this might not be the best plan for you because of these restrictions. But if they decide that that's the plan they want, they are allowed to, sign up and enroll in any plan they want. But we just help them make informed decisions. We assist with enrollment issues. We don't enroll people in Medicare, however. That's Social Security does that. But we can assist them with enrollment issues, to the best of our ability based on the systems we have access to. And then also SHIP does outreach and presentations to groups on Medicare. And that's pretty ongoing and year-round. Okay, Christy? We also help people apply for low-income programs like Extra Help, that is help paying for your Part D drug costs, and Qualified Medicare Beneficiary, QMB, that helps people pay for their Part B premium, which is this year $185 a month. Everybody on Medicare pays that Part B premium unless they're low income and they're in the Qualified Medicare Beneficiary Program and they get it paid for them by the state. But those are some programs that SHIP helps people apply for, or sometimes we just tell them what the eligibility limits are. We get information on applying for Medicaid. I will help people apply for Medicaid, but not all SHIP counselors feel comfortable doing so. But I do help people apply for Medicaid. It usually takes anywhere from 30 to 45 minutes, depending on the information that they have available. But we can help them apply for Medicaid. I file complaints through the state office. I'm pretty much the only one at the state that files complaints for Medicare Advantage and Part D plans. That's what the DOI has jurisdiction over. We don't have jurisdiction over Medigap policies, however. But I do file complaints for those plans. We assist in the filing of appeals, right? Because if you don't like something that's going on with your plan, you can appeal to the plan. We assist on filing, with the help of filing those appeals. And we're not attorneys, though, so we don't, show up in court or for these hearings and all of that. We just educate and help with the filing of appeals. We help make referrals to partner agencies all the time, and we help with billing issues. That comes up a lot. People that get billed wrong and they don't know where to turn. They usually call SHIP, and we tell them what the process is to start, but we help with billing issues as well. What services doesn't SHIP offer, so we don't offer assistance with Medicaid-only issues, because those are not something we have. We don't have access to their systems. We just, unless they're also on Medicare, we just refer them back to their Medicaid office. We don't offer assistance with para. Para is the state employee retirement, health insurance retirement. We can answer questions, but we refer them back to para. Same with retiree, railroad, federal insurance, or COBRA. We don't really assist, but we can get you to the people that can help you with those. We don't assist with Medicare claims that are over a year old. Medicare really bulks at paying anything that's over a year old. Now, have I done it for somebody who's pretty desperate and didn't know where to go all this time? Yeah, there's avenues to do that, but as a rule, Medicare won't pay a claim over a year old. We don't get involved in collection issues, because once something's gone to collection, it's out of our hands anyway, and there's nothing that we're going to be able to do about it. So we always tell beneficiaries, if they say, hey, they're going to take me to collection if I don't do this, pay it, stop it from going to collection, and you're going to be better off in the long run. But SHIP doesn't help with collection issues. We don't have access to other state agency systems. So like I was mentioning before, we don't have access to go into the Medicaid system and see how long you were on Medicaid. We don't have access to go into Social Security system and see, when somebody was on or off Medicare, or Social Security. We have contacts at those agencies that can help us, but we don't have access to those systems. Private insurance issues also, we wouldn't have access to those issues either. Okay? So to be a SHIP counselor, what does it take? Well, there are some training requirements, and it is pretty extensive training. So we always tell someone, if you are interested in being a SHIP counselor, you really need to have some time to commit to this, right? Because not only is the information really dense, and it's ever changing, right? Somebody will come up with a new rule, and then we have to implement the new rule. I tell people it takes 6 months to a year to really even start feeling comfortable with the information. But after 6 months to a year, you're going to get the same questions over and over. We tell people, if you like to do research, this is a great position if you like doing research, because you're always having to look up rules and regs and apply them to whatever you're working with that's in front of you. But we do have SHIP training requirements, and every SHIP counselor has to go through a standardized, nationalized curriculum, and it's designed that way so that every SHIP counselor in the question we're getting the same training. So it's online, it's self-paced, and it's offered through the SHIP TA Center. There's 4 levels with 4 to 5 courses in each level. So the first level would be Medicare Basics. The second level would be Medicare Coverage Rules. The third would be Appeals and Penalties. And then the fourth one would be Other Insurance and Assistance Programs. And the training completion times really depends on how comfortable somebody is, doing online training, how much they know about Medicare going in, what their motivation and information retention are. All of those things really are factors in how long it takes. I've had people that have come in and they've done the training within 2 weeks and they're done and they're already shadowing somebody in their office. I've had somebody and it takes months for them to actually get to the training and finish it. Because, like I say, a lot of these people are volunteers, right? And they have lives. And so it can take them longer to get through the training. But we do have a pretty intensive standardized training for folks. And it also weeds out people who get in it and think they may be interested, and then they start getting into the training and realize, this isn't for me. We would rather have that happen than to take them through, get them certified, and then they drop out. So just to, be clear up front that the training can be pretty extensive.
Kathy, I want to turn your attention to the chat. Courtney has asked, do you help folks understand if and how Medicare covers certain services, either once they're enrolled or in the context of deciding whether they should stay in their work insurance or enroll in Medicare?
That's a great question. Yes, we do. That is a bulk of what we do is once we, we're talking to them, what we do is it's very individual, right? So we ask that particular beneficiary questions, or we use our listening skills because they're going to tell you this stuff in the conversation. What's their health like? What are their finances like? What kind of coverage have they had? What do they feel like they're needing now? And then we will look at certain plans that cover those services or certain plans that cover those particular drugs that they're on now. And we can also decide at open enrollment, you're in a good spot to go ahead and stay with your plan because nothing's really changed. Your health hasn't changed. You haven't been diagnosed with anything new. You're probably good here and you're able to afford this plan, right? You're probably good sticking to where you are. We might talk to the next customer who has now some more health needs, right? They've been added a drug or two over the course of the year, and we might need to look at a whole different plan for them. So that's one of the things that SHIP does, yes. Good question. Recruitment and retention. So with this, oh wait, I think we missed some. Did we not? Oh, I think we missed, yes, thank you.
Yeah, sorry
So,
about that. I think we're now on the right slide.
yeah, we are, thanks. So ship recruitment and retention, how do we get these folks that come into SHIP, right? Well, I do presentations like this, and I talk to people about the virtues of SHIP and, you know, how you can help your fellow beneficiaries here in Colorado. But we also get a lot of students that come in, a lot of attorneys who are looking for continual education credits. We get retirees on Medicare, friends of current volunteers. We get retired nurses and hospital staff, right, because they've been working in the health field for a while. Some people who've been helped by SHIP say, hey, you know, I would love to volunteer. How do we get into that? So people who've been helped, volunteers that want to help administratively, maybe they don't want to do all this and go through all the training, but they just want to help input data, let's say, for instance, or they just want to help people apply for these programs, but they don't want to do any of the counseling. We have a spot for you as well. Once new trainees, after they become certified, they usually shadow some folks in their office who've been doing this for a while, right? So they can hear the conversations, hear the phone calls. And once they're comfortable, that's when they can begin to counsel on their own. And get additional training on other topics throughout the year by not only the SHIP here in Denver, but also by the SHIP TA Center. They're constantly offering training throughout the year to keep people's skills sharp. Christy, thank you. So the best volunteers are those who are interested in helping others, obviously, because this job is really about that, and have a passion for making a difference with folks. They should have good communication skills with ability to explain complex information in a clear and concise manner. They should be pretty computer and internet savvy, people who are committed to regular training and ongoing support, and individuals not currently holding an active broker's license. You can't do both. You can't be a broker and be a SHIP counselor because there's a conflict of interest there. So I always check when new people come on board to make sure they don't have an active broker's license in order for them to go through the training to become SHIP volunteers. So this was a question that Christy had that I had to flesh out a little because I hadn't really thought about it, but she asked me, so what are the limitations of librarians and staff? Let's say you don't want to go through the training and become a full-fledged SHIP counselor, but you still want to be able to help people that come into the library, and I applaud that. I think that's fantastic because you're such a trusted resource in the community for all things, government information, you get it. So, yeah, there are opportunities if you don't want to go through the training and become a full-fledged counselor. You can also do some of the things that SHIP counselors do. However, there's some limitations. So being a SHIP counselor certified gives better access to Medicare, Social Security, CMS, which is Centers for Medicare and Medicaid Services, and other agencies. So it would be kind of difficult without being SHIP certified to be able to address billing and claims issues as in-depth as SHIP. Pretty much all you'd be able to do is refer them back to the billing agency and ask questions, whereas we can call the person that's doing the billing and, we have a little more juice saying, oh, we're from the DOI and we're calling about this bill. Maybe unable to help with Medicare-specific issues, because Medicare rules and regs can get into the weeds, so that you may not, just have run across it before. You may be unable to help. You wouldn't be able to file complaints because that's my domain. I'm the only one that files complaints for the state. And you couldn't obtain a SHIP unique ID for backdoor Medicare number. So once you get SHIP certified, we have a backdoor Medicare number we can call. And what happens is it's a dedicated line for SHIP counselors so that we don't have to call Medicare and be on hold all day, right? Sometimes we have clients sitting there in front of us and we need answers now. And so, we have a backdoor number we can call. We give them our SHIP unique ID, and they answer our questions. It's fantastic. We have been trying to get one for Social Security forever, but we do have one for Medicare, and we're real happy about that. Okay?
Hey, Kath, so I wanted to interrupt if that's okay, just to speak a little bit
Sure.
about this too. So, when I, like so many things, I invite somebody to come in and tell us about this like resource that's available in the community or something that we can do as librarians if we choose to like kind of dive into this, right? And so, the
Mm-hmm.
reason that SHIP is even here is because one of the librarians in Colorado, Ashley, out in Yuma, she's actually the youth services librarian, identified a need when their local SHIP counselor was no longer like retired and not going to do any continuing work on this, and she became SHIP
Sure.
certified and has done it.
Yep, we love Ashley.
Yeah,
Ashley's
Ashley's
great.
amazing. By no
Is,
means
yeah.
does that mean that that's an expectation of anyone on this webinar or anyone in a Colorado library, but it is an option. Now, that's something she does like kind of within her work. In other words, if she's not doing something else, it's not like she's adding this and now all of a sudden there's extra stuff. But we can
Mm-hmm.
also host people like Kathy to come out and tell our community members, right, about SHIP, about Medicare, about applying for these things, about the counselors that are available in their area, even if we
Mm-hmm.
already have them, but they just don't work at the library or they're not like at our library. But also, Kathy, could we invite SHIP counselors to utilize library space, whether it's a study room or a table to do SHIP counseling? Can we invite and host, like hold the space for SHIP counselors in our area?
Absolutely. Yeah. I don't get that a lot where people are having problems because they're, like I said, they're usually attached to a senior center or area agency, so they have the space. But yes, absolutely. Yes.
Oh, that's wonderful. And another thing that we get asked a lot, well, I should say that I get asked a lot by organizations that use volunteers to do work is, can a library help us, like help you recruit volunteers? Like, is there a way that we can, utilizing our reputation and community, utilizing our already existing networks, like our friends groups, we have book clubs that have a ton of people in them that are retired and looking for something to do. Can we also work as a recruitment kind of partner with you to get in community volunteers?
We would love and welcome that with open arms if you could help recruit. It's one of the one of the harder things is to recruit folks, especially in this climate, right? You're asking people to volunteer. So yes, absolutely. And a couple of ways. So if you got somebody who was interested, we could either chat and steer them to their local SHIP, which would be the best because then they could talk to the volunteer coordinator and get onboarded and all of that. Or you could get them to me and I could get them to their local SHIP to get them onboarded. Absolutely. That if you do nothing else but help us recruit volunteers, it's a win. It would be a huge win. Yes. Yes.
Thank you, Kathy. Yeah, that's it. Often we have to think about, like, we people who work in libraries, we have to think of like, this is an amazing thing. How can this fit into what we do? How can what we already do fit into this? And so that's why questions like this come up so often with partners. Thank you so much for your generosity in answering that. I'm going to go to the next slide for you and turn my camera off. Thank you so much, Kathy.
Of course. Okay, so what librarians and your staff can do. So when I was thinking about this, I'm thinking, okay, let me look at their role and what can they do if they're not actually SHIP volunteers? And I thought, well, you would act much as a friend or a relative might act with a Medicare beneficiary, right? That they go to their son or their daughter and say, hey, I don't have a clue about this. Can you help me enroll? Can you help me look for some low-income plans or low-income programs to help me pay for Medicare costs? So you can act much like a friend or relative to help people with Medicare beneficiary questions without being SHIP certified. So you could answer general Medicare questions, right, which you're probably already doing now. You could help apply for Medicare. Pretty easy to do. You go on the Social Security website. It tells you in a little blurb what you're going to need before you get started. If you get halfway in and realize they don't have the information they need, you could stop. It gives you a number, a confirmation number, and you can go back in when you get that information. So that's something you could do. You can help apply for cost-saving programs like QMB, Extra Help. Takes maybe 15, 20 minutes as long as they have all their information and their financial information, because these are financial eligibility type programs. And you can help them create a website for Medicare.gov, which is the official website for CMS. If you could advance the slide, I'll show you what it looks like. And I am one of those that I get it. Nobody wants to sign up for another account. I get that, right? But I tell beneficiaries, if you're going to sign up for one more account, Medicare.gov is the place to have an account. Because you can see here, and I don't know if you can see my cursor, it is the official website of the U.S. government for Medicare. Anything that you would want to know about Medicare, you could probably find the answer here. And so I just wanted to point this out, that if you can help people sign up and create an account here, that would be great, because all their drug lists are housed in. Anything they do with Medicare is housed here. If they decide, I saw a doctor in May of 23. Who did I see? They could go back and look at that information for who they saw, what date, and why they were there. Your drug list is housed there. Past plans are housed there. It's just a really good resource for all things Medicare. If a service is covered, you can find it here, or if it's not covered, you can find it here. You can chat with somebody in Spanish or English here, find providers. It is the official website. And not a lot of people sign up because, again, they don't want to sign up for one more account. But this is a way that you all could help by saying, hey, this is really important. You sign up, you have a username account. Then anytime you have any questions about your Medicare life, you could go in there and create an account. So that's one way you could help. Next slide. Another one is, and you've probably seen this in your library, the Medicare and You Handbook. Anybody can order these if you wanted to order them bulk for your library, but everybody gets one of these in the mail. If you can believe that, in 2025, they're still mailing these out paper. Unless you opt out to get it online, you're going to get a paper Medicare and You Handbook. They come out every year around late September, early October, and this is like the Medicare Bible. Any question you have is probably going to be answered by looking in this handbook. Now, where we run into, not problems, but challenges is when somebody's specific information, right? And that happens in Medicare a lot. Their situation is so specific that you might find the vague or the overall information in the Medicare and You Handbook, but it might not apply to their specific information. But this is a great resource for all things Medicare. And so I would say, if you're answering general Medicare questions, to have this available to look up answers in it. Anything about enrollment, to late penalties, anything like that would be in the Medicare and You Handbook. And I'd also like to point out, I can also be a resource to you all. I'll give you my contact information here at the end, and if you ever have any questions, or you have a beneficiary that comes to a question that you can't answer, just pop it to me by email. I'm happy to do the research and help you. How can you reach us? So you can find your local SHIP office by calling this number, 888-696-7213. It asks for your county of residence, and then you're directed to the SHIP location nearest you. So what happens is, though, people call, but they never leave their county. So we end up having to call them to get their county. And, it would just be so much easier if they would just leave their county and get redirected to their local SHIP. Just so you know, if you do decide to become a SHIP volunteer, you're protected by the Federal Volunteer Protection Act of 1997. You have immunity from civil liability for acts or omissions that result in damage, as long as a volunteer was acting in good faith and within the scope of their duties. So that means that, we're protected by getting sued, by giving wrong information, or, not dotting our I's and crossing our T's. But we don't want to do that, right? We always want to double check our work so that this doesn't happen, but you are protected. And then Colorado added further protections in 2006 by extending this protection to federal law federal healthcare professionals, which is what SHIP volunteers are considered. Next slide. So some SHIP counselor responsibilities, obviously confidentiality is of the utmost importance. We get so much health information from folks, and you need to, be really careful with that information. Only discuss cases when necessary. You keep client information safe and confidential. Don't ride around with files in your car. We are required to take a privacy and confidentiality training annually. It takes probably 10 minutes to get through, but it's a requirement from the feds. Once you're SHIP certified, you do obtain your SHIP unique ID. And again, it allows backdoor access to Medicare without having to wait on a hold to get your questions answered, because we just don't have time to do that. And then another responsibility would be SHIP reporting. In order to show the federal government that, hey, we're valuable and what we do matters, we have to report our work. Otherwise, it's like, if you don't report it, it's not getting done as far as they're concerned. So SHIP reporting is another huge part of our SHIP responsibilities. This is, again, SHIP snapshot, where we're at. I think we talked about this earlier, what we do. We're everywhere. SHIP is everywhere. Next slide. So questions, comments, here's my contact information if you are interested in becoming a SHIP counselor. If you just have any other questions, if you want to refer, beneficiaries that have questions to you, to me, you want to answer the Medicare and you want to order some Medicare and You handbooks, any of that stuff that we've talked about today, you can certainly reach out to me and I can help you navigate that for sure.
Thank you so much, Kathy. So that's the end of Kathy's slides, but she has so much more information, and like so much of this, it's a lot of information, but we'll have our own questions. So I guess this is where we open it up to you all who are here. If you have any additional questions, or maybe want to think through aloud with us or in the chat with us, what it is that you can do regarding SHIP, if there's any thing that was unclear, whether it was about Medicare coverage or SHIP's activities, or finding a SHIP counselor in your area. So does anyone have any questions? You can go ahead and put them in the chat. In the meantime, oh, there we go. Mary has a question. Can someone be penalized for not enrolling in Medicare when they become eligible? That's a question that people have asked before.
Yes, ma'am. They can get penalized for not enrolling when they were first eligible. They do get penalized. SHIP doesn't levy penalties. That's a Social Security function. They not only determine what the penalty will be, they also enforce the penalties. And I can tell you, it's not double or anything like that. Like if you don't sign up when you're supposed to, you're not paying an additional $185. It's usually something like, I don't know, $1 or $2 more that you're going to pay over somebody else. But think about that. Over the course of your Medicare lifespan, you're paying, out of pocket a lot more than your neighbor just because you didn't sign up when you were first eligible. Now, let's say that you were filling out your Medicare application, and I'm so sorry, I just didn't hear that. You were filling out your Medicare application and you didn't put on there, which is a really important question, who did you have Medicare insurance with prior to now coming on to or who did you have medical insurance with prior to coming on to Medicare? If you leave that blank, they're going to assume you didn't have coverage, and then you get penalized. So let's say you did have coverage, you just didn't put it on the application. There's ways to waive penalties too. If you just, go to through Social Security, the proper channels, you can get your penalties waived as well.
Thank you.
Is there a website for, of course. Is there a website for, go ahead.
I was going to say, I put the link in the chat for that, and I will share it on the screen. This is the SHIP website. It's on the Colorado DORA page. Yeah, if you were to Google, because this happened to me literally right now, it happened, SHIP Colorado Insurance, it will take you to like the general ship like .org page, and it'll list like, oh, Colorado website, and it'll take you here. So this, it just makes sure that you go to the one that's like the government website. But yeah, this is it.
Yeah, and this is our we add to this as well as like the Division of Insurance adds to this. All of these boxes you see here, we give them this information to put on. So there's like, if for instance, a Part D newspaper that I create that I give to them in September for the upcoming year. If you scroll down a little bit, there's Medigap policies right here. I do that publication to get that out before open enrollment. If you scroll down, yep, there's all kinds of information about SHIP. There's all kind of information about other senior health resources, a lot of COVID. This is kind of outdated, but COVID information. It's a great resource for senior health, this page is. And I apologize, I should have put that in the presentation. So right on, Christy, for that catch. That's a good catch. But this is a great page for all things senior health, Medicare, Medicare fraud, all of that in Colorado. Yes.
I don't know if you caught Mitch's kind of comment because it was beneath another, but we would love to find a ship counselor in our area. So Mitch, I'm pretty sure is Aurora also. So how should I go back to one of the slides, or on this page, can we find the ship counselors for our areas?
You might be able to if you scroll down. I think at the bottom there's ship, finding a ship. Let's see.
Oh, there it is, ship
There.
assistance.
Yep. Yep.
And so if someone in a library, right, so wanted to locate their ship counselor, they could just call this number that's listed
That's
here.
correct.
Okay,
Yep.
excellent. Or they could call you, right?
Yeah, and I'm always available. And I got to tell you, I don't mind getting those inquiries, so don't feel like, oh, I don't want to bother her. Really, I don't mind. I would rather you just reach out to me than spend half an hour looking for something, right? We don't have that kind of time. So, yeah, just you can either reach out or you can call and these are by county, not by city. So just so you know, too, you have to figure out what county in Aurora are they in, because there might be more than one county for Aurora.
I put that link in the chat as well. And of course, this is Kathy's contact slide. Like she said, she's so responsive. I could say that personally. She will be responsive to you, hopefully, also as well.
Oh,
So,
yeah, yeah.
do we have any other questions? I think this stuff is fascinating and so important, and really, especially for the folks who are on this call and the ones who have signed up for this webinar, especially those of us who work in adult services, that is with primarily adults, we work disproportionately with older adults, right? And disproportionately, their needs are such like that these are things that we need to know about, even if we don't participate in volunteering in this or getting certified in this, just knowing that SHIP is a thing that exists and there's a place that we can connect our people to so that they can get their insurance is so valuable and important. So thank you so much, Kathy.
Oh, you're so welcome.
Do we have any other questions? We have Kathy. She's our hostage for the next 15 minutes. Courtney says, of course, you're an
I can
amazing
talk about
presenter.
Medicare all day long if you want. We can stay here all day. I can talk about Medicare.
All right, well, that makes one of us. So I'm going to stop sharing. And I'm also going to stop recording, but not before saying one more time that anyone who registered for this webinar, whether you attended or not, you will get Kathy's presentation. You will get the link to the SHIP website because we shared it in this conversation. And you will get the link to this webinar recording. So I'm going to stop that now. And thank you so much, Kathy, for being here with us.